For me, so when I was 30 years old, I had undiagnosed and untreated low thyroid symptoms, which mimic psychiatric symptoms. At that point, I had also worked in that locked acute care ward for 4 years, and I was going into burnout. On top of that, I would say I had significant history of trauma that was never addressed. I had never gone through therapy or anything for what had happened in my childhood. So there was those three core things that were happening at the same time. So I went to see the family physician and they did the blood test and they found my thyroid was low. And the proper protocol would have been to treat the thyroid disorder to see if that would resolve. But they suggested I started on antidepressants at the same time. So I was started on a low thyroid medication as well as an antidepressant on the same day. And within about 2 weeks, I became hypomanic. And that was the first time I've had a hypomanic episode. The thing that is disturbing to me in that process, and that I have seen happen to kids and adults alike, is when somebody comes to you and you talk to them for 10 or 15 minutes, or it might have been a patient that you've known for a while, but the real core issues, the underlying issues in this person, for me at the time was burnout and also disillusionment in my career because I saw so many people come in, get on high doses of cocktails of medications, not do well, have adverse reactions. Many of the times, those medications had to be immediately stopped. Litany of trials of drugs. And it became this meat grinder that I was working in. And very quickly, I knew from day one, there was many questionable practices in psychiatry. There was all the childhood stuff that was not addressed. And then I had a medical condition that caused problems for me. Other people might have nutritional deficiency. Other people might have a brain tumor for that matter. You really don't know. And so in psychiatry, when somebody comes to you, there's this mad rush to diagnose and medicate someone. And that was what happened to me. When I suspected, like just like most healthcare professionals who tend to self-diagnose, while I was going through my education and working in psychiatry, I suspected I had something going on, I suspected it was PTSD or anxiety, which was accurate. I think it was, and based on my experiences in the context of where I came from, that was totally understandable in terms of like, I actually saw a psychologist recently. Once I did the metabolic therapies and keto, I was able to address trauma. And the diagnosis they gave me was CPTSD. Not that I have an attachment to that diagnosis, but that felt more accurate to me. But at that point, when I was 30 years old, that was the first thing was just, oh, here's some medication. And so that's how I entered into the mental health system.
Gotcha. How
Yeah.
did the medications affect you? I know you mentioned that you had that hypomanic event. What is that like?
Hypomania is a very seductive state, I would say. It was a sense of euphoria. I became outgoing. That was just a personality change. I had lots of energy, lots of creativity. At the same time, I was irritable, agitated at times. My judgment was impaired for sure. There was hypersexuality. There was lack of some focus in some areas and other lack of focus, more spending. And it was, it's kind of, now I look back at it and Peter Breggin, he's one of the pioneers in the in a critical psychiatry movement. And he talks about medication spellbinding. So it's a person who is under the influence, just like somebody who is on cocaine, on alcohol or anything. Psychiatric drugs fall under, psychoactive drugs. So I was under that spell during that time. And I remember thinking, even though, I was a psych nurse and I had witnessed all of these things, when it happens to you, I thought I must have been absolutely deprived all my life because I did not know that you can feel this good. and it wasn't really good, but it felt like just like Gabor Mate. I don't know if you're familiar with him.
Yeah.
He's written, yeah, In the Realm of a Hungry Ghost. He does a lot of work with addiction, and he says that when people, his clients, describe to him the first time they ever had cocaine or the first time they ever had meth or whatever it is their drug of choice is, they describe that feeling as being embraced by a mother, like, or being just held. And in a way, that is how it felt to me when I first was on psychiatric drugs. It was this high that I did not even know was possible to feel that way. So it was definitely an alteration of something in my brain, in my body, that was very drastic. And over the next 13 years, I was trialed on 10 different psychiatric drugs. 8 of them I had to immediately stop within 3 days to 2 weeks, because I had severe adverse reaction. One of them was lethal, which was a medication called Lamictal. I had developed what's called Stevens-Johnson syndrome. You can actually die from that, and it was on the lowest dose, 12.5 milligram. And the 2 that I stayed on the longest, I would say, wreaked a havoc in my life. I had weight gain, brain fog, cognitive decline. I had no energy. I had the most disturbing thing was suicidal ideation. I had never considered suicide before I got on psych medications. It just was never on my radar. For a 30-year-old who had gone through everything that I went through, I was in a loving relationship. I had my daughter. I had a career. I had graduated from university, like all of these things that I accomplished. And then at that point, I actually started my YouTube channel back then too. A year later, after I became a nurse, and I thought I wanted to raise awareness about mental health. And for a decade, I did absolutely nothing with it. I wanted to write, I wanted to do all the things that I was doing now back, 14 years ago, 13, 14 years ago. And once I got on psych meds, I kept working as a psych nurse, but it was just barely keeping my head above water.
Wow. Wow.
Mm-hmm.
You hear that story so many times with people, especially with bipolar, like trying to get on a medication, adjust a medication, get off, try combinations of medications, all the side effects you hear about. In your experience through your career, being 2024 now, do you feel like we've made any great strides as far as medication for mental health, or is it pretty much about as dire as it was when you first started?
So this is how I look at it. Psychiatry has a very checkered past. So way back, they used to use waterboarding physical lobotomies, brain lobotomies. What has happened in the last 40 to 60 years is we use drugs as the first line of defense. And if you look at the sales for antidepressants and psychiatric medications globally, or even just in the US alone, the top 10 drugs in the US, psychiatric drugs, gross about $88 billion.
Wow.
So what has happened, and for most people, they're told that mental illness, the narrative, the dominant narrative is around chemical imbalance, which the pharmaceutical industry has done a fantastic job of selling to the public that there is something wrong with your brain. There's a chemical imbalance, even though it is a lie and a theory, it's all it is. They've done an amazing job so that people trust doctors and psychiatrists and go in and are told they have to be on these medications for life, and that these medications, drugs, are safe and well tolerated by most people, which is not true. At least from my experience of witnessing day in and day out for 17 years, that's not the case. In fact, they're not well tolerated by most people. They're toxic to their system. So, have we made, excuse me, have we made progress? Well, I know this is strong language, but what I consider treatment with drugs, especially long term, and I'm not, I think for psychiatric medications in acute crisis or short term stabilization, there's a place for them. But that should be last resort, and along with everything else that can be implemented. what people described to me and what I experienced in my own life was what I would call a chemical lobotomy. You're cut off from your emotions. You're not able to address your trauma. You can barely survive. And then there is the effects that people experience, some of them which are irreversible and permanent, are disturbing, like your sexual dysfunction, involuntary bodily movements. There's all kinds of things, the cognitive decline that people experience. It's essentially strips you off of your humanity, not to mention the metabolic dysfunctions that it causes. For example, for treatment for schizophrenia, you're talking about Lauren, people die 20 to 30 years younger because of those treatments. So to me, that's not progress. We're human beings. Why would you take that humanity out of someone and their dignity? And to me, that's what I witnessed over the years, that over time, especially when I went into the pediatric system, and I realized this is what we do to 13, 14-year-olds. We put them, they come in and they say, I've been bullied online, which means 24/7, by the way. And there's actually, I was reading on X today that there's an inquiry in New Zealand of 6 kids that died between the age of 13 and 16 who were all put on SSRIs. And one of them was a 14-year-old girl who was bullied all year in 2017. She was put on an SSRI, fluoxetine, and the doctor increased it to 10 and then to 20 and then doubled it to 40 and told her he would see her, 4 to 6 weeks, and she committed suicide during that time. The second leading cause of death for youth, besides motor vehicle accidents today, is suicide for 14 to 24-year-olds. Why are our kids thinking that their lives are not worth living? Is this forward movement for us as a society?
Strong statement. Wow. Strong statement. I don't think there was any risk of a pharmaceutical sponsoring our podcast, but now for sure they're not after them hearing that. So, yeah, that's really strong, and that's really disturbing about the suicide rates as well. Fortunately, we know, and you know now, that there's other ways to treat this, and we're probably doing this in the wrong order. Like, we can start with some really simple basic things, and then, like you said, use medications when needed temporarily for certain situations. And so eventually you found metabolic therapies for mental health. How did you discover information about that?
So I actually started implementing metabolic therapies in 2016. I really didn't know what that was, but essentially I started with getting rid of birth control, which that is another topic and information that they cause all kinds of problems for a lot of people, a lot of women.